Hi, I'm Dawn Catucci. I'm a school psychologist at Ardsley High School and a licensed mental health counselor in private practice. We started working with CBC and getting really interested in DBT because teenage years are quite turbulent, and like many schools, we were facing lots of kids that were coming in with a lot of emotion dysregulation that was getting in the way of school, of their studies, of their happiness, and we started to piece together that these skills can be really helpful for teenagers. The most important part of the program was for us to be able to get properly trained to implement evidence-based practices in a school setting with fidelity, and to maintain that fidelity over the years of which we've been using it. And really, the bottom line was to help kids, to help as many kids as possible within our own school district, and to talk to others so that they would consider implementing these practices within their school districts, because we see the changes that happen within kids, and it's remarkable. I do recommend this program to other school districts because, and I have been an advocate for that and very passionate about that, talking to pretty much anyone and everyone from other schools, because evidence-based practices are hard to come by within the community. They can be expensive, there's long wait lists, it's hard to find people that are trained in DBT and in CBT, and within a school setting, the skill sets are perfectly matched for school. Social emotional learning is needed and required now in New York State. So there's that piece to it, but it levels the playing field for kids that might not have access to these services outside of school, or where there might be long wait lists or expensive, all of the things that can get in the way. And in a school setting, that's where the kids are. And school psychologists are trained and equipped to work with these kids and run these groups. I feel that we are so fortunate because mostly where we live has been very helpful because we're so close to CBC, that we've been able to have the advanced training and the rigor of learning all of these skills and being able to stick to fidelity of treatments that are complicated treatments to learn and to incorporate into a school setting. For us, it had never been in a school setting before, so our trainer was amazing and brilliant and really patient with us and helped us to really be able to modify and implement appropriately without losing the fidelity of the treatment. And I think that's why it's been so successful, because now that many years have passed and we continue on this path, we're better able now to pick and choose how we're running our groups and what students we're going to be doing commitment strategies with to try to get them to join the groups, and really keeping track of, on a weekly basis through our team meetings, of how we're doing in that process. And I think that it really helps the students to be more successful. When we started, we were the first team to do DBT in a school setting, and we are 9th through 12th grade. After a few years in, our middle school then also started to implement at the middle school level, and then a few years after that, our elementary school started piloting a elementary school DBT program that's not yet published, and they're in the process of working that through. And so what we've seen in our district, being that now it's been a few years at all 3 levels, the kids that we're offering DBT for now are coming in with far less intense problematic behavior. And so for many of the kids, we're doing skills only, and we're teaching also in a preventative way more. And for the kids who really require the comprehensive DBT, the individual, the group, counseling, they may have already had some exposure to it in the past, and so they're learning it in a quicker way and with more ease. And if they had no experience in the past with DBT, then they're just coming in naturally and just following along with their peers that are doing it as well. It changes the lives of kids so dramatically. parents are so happy to see the changes in their kids. And as a team, that's what keeps us motivated to keep on going with it, because it is a lot of work and our caseloads are very high. But when you see how it changes the lives of kids who are committed to coming, it is unbelievable. As we were a few years into doing dialectical behavior therapy in a school setting, we realized that a lot of the kids that were maybe having a lot of difficulty in school weren't multi-problematic. They didn't have depression, anxiety, and lots of other things going on that was getting in their way, which is our criteria really for DBT. It may have been affecting their personal relationships, and it may have been affecting certain things, but for some of the kids, it may have just been anxiety. So I had already been doing cognitive behavioral therapy outside of school, and our whole team went to a 5-day training that Dr. Lotta McGinn conducted over at CBC, and it was amazing. Of course, she's brilliant. And we were able to come back and really implement in a school setting. And other school psychologists in other buildings within our district also did that. We went, it's offered every summer. And that has been really helpful. So now when we have parents that are really worried about their anxious child, we're able to say, hey, we can do cognitive behavioral therapy for them. And oftentimes the kids get better, obviously, very quickly. And they sometimes don't need a 504 plan or to go into special education or even extended time. They're able to utilize their skills and manage that level of anxiety. We're just really grateful that we had an opportunity to get trained and to use this within our school district and help so many kids. Our administration has been exceptional about supporting us, supporting our students. They see the need for it.